Hi, I hope you're all locked down at home while we're all working here in hospital for you. I just wanted to highlight that there's a lot of concern from patients whether emergency work apart from coronavirus related problems is happening in hospitals. At Kauvery Hospital, we are fully open for any emergency related problems because you still know that heart attacks, strokes and various other problems will still continue to keep happening. I just wanted to highlight about a patient that I'm going to be dealing with right now. It's an 82-year-old lady who had a fall at home overnight. She was left at home, nobody to help her because she lives on her own. Unfortunately, the next morning, the family called and they could not reach her, so they had to break into the house and they found that she was lying on the floor. She had a fracture in her spine. And that is what we are going to operate, and we are going to show you what we are doing.
At the time of induction with GA, only 2 persons inside the OT, no other people. One is an anesthesiologist, the second one is an anesthesia technician, both of them in full protective equipment with mask. Second thing, at the time of induction, normally we do mask ventilation, we should not do it. Induce with the drugs which acts very quickly in less than 60 seconds. After induction, intubate a patient with ideally an equipment called video laryngoscope, which has a disposable blade. Intubate with the video laryngoscopic blade and discard the blade. The moment the circuit has been connected, the circuit is closed circuit. Then all the other personnel can come in. This is at the time of induction.
So I'm just going to show you what exactly we are going to do. So we take all the precautions. So we wear special masks. We do protect ourselves as much as we want to protect our patients.
Nurses play vital roles in fighting against COVID-19 in operation theatre. The entire team, including scrub nurse, will wear full personal protection. There will be every minimal required floating nurse and technician. Apart from all regular sterility measures, the temperature will also be maintained as usual. Every patient should be considered as a COVID-19 and follow normal precautions.
It's time for me now to go and do the operation. So I'm going to scrub up and be safe. Be safe at home. Even when you're not under lockdown, do not go anywhere unnecessarily unless you really have to. So this is the kind of gear that we wear, a full PPE covering our entire body, and then we cover the eyes as well, and then we're going to scrub up. Healthcare workers, especially surgeons and theatre staff, they're fully protected because the virus is in the community and you do not know which patient is having problems. In an emergency situation, it's very difficult to test COVID and wait for the results, so it's better to take universal precautions. We're wearing PPEs, glasses, make sure you protect your eyes, and at the same time, you get yourself fully sterile and scrubbed up. We're going to do this operation today, and this patient should be discharged from hospital in a few days' time.
Before extubation, that is before reversal of anesthesia, switch off the positive pressure ventilation inside the theatre. Then wait for some time, then remove the intubation, then do the extubation. Then the patient is ready for going out of the theatre.
Do not neglect any emergencies. We perform all surgeries and the hospital takes all precautions to avoid any cross-infection between the surgical team and the patient. We are very well equipped to manage such patients during this situation.